Good morning, and thank you all for being here today, especially during this time when so much is happening at both the state and federal levels that directly affects the health and well-being of millions across our nation and right here in New Jersey. I'm Laura Waddell, the Healthcare Program Director at New Jersey Citizen Action, and I'm joined by a host of amazing people that we'll have and hear from in just a moment. You know, we've all seen the numbers being proposed in Washington, $880 billion in cuts to federal funding for Medicaid to states. And if allowed to go through, would cause devastating impacts throughout our healthcare system. And until today, many healthcare stakeholders have been raising their voices, but oftentimes these efforts have been happening separately in different corners of the state and the country. So what makes today so significant is that we are all coming together, unified, to send one clear and urgent message to all of New Jersey's federal delegation, especially those serving on the U.S. House Energy and Commerce Committee, to protect the 1.8 million residents who rely on Medicaid in our state and the institutions, workers, and providers that care for them. We're urging all of our federal delegation to vote no to any federal funding cuts to Medicaid. And at the state level today, thanks to the leadership of Chairwoman Carol Murphy and her Assembly Health Committee, we have an opportunity to hear from all sectors of New Jersey's healthcare systems, institutions, providers, advocates, and most importantly, the people who rely on these services every day. In many ways, our country is still emerging from the profound impacts of a global pandemic that exposed the vulnerabilities in our healthcare system and deepened the needs of our most vulnerable residents. We cannot afford another blow. These cuts would be unsustainable, and the consequences would be felt in every community. While you may be hearing from a wide array of stakeholders at the Assembly Health Committee hearing later this morning, right now, I'd like to invite a few of them represented here to speak and share their perspectives of how those proposed cuts will impact their constituencies. But first, I'd like to welcome the chair of the Assembly Health Committee and Majority Whip, Carol Murphy, to talk a little bit about the importance of this moment and what led her to convene a special committee hearing today at 11 focused on the impact of proposed federal Medicaid and Medicare policy changes on New Jersey residents and our community. Chairwoman Murphy.
Thank you. Thank you. Thank you all for joining us today. So you know what? This was a no-brainer. And I'm going to start off by telling you that. When I saw what was going on and coming out about the $880 million cuts that we are facing here across the nation, the first thing I did, and I'm going to be up front, is to call my speaker, got in touch with the speaker, got in touch with the majority leader, and he said, we have to have a hearing on this, which they agreed because they know the importance of what it is to address this issue. Today's hearing is so extremely important for us in the legislature, but more importantly for our advocates, for the providers, for our residents to know that we are doing something. Today we are going to hear some of those impacts that these cuts will have on us, have on our families, have on the job losses, have on the businesses that may go out of business because people are going to lose their jobs because they have to now suffer the consequences of no Medicaid and Medicare. My seniors may have to go without medication because Medicare is going to be cut. Medicaid is going to be cut. My people with disabilities are going to go without medical treatment. And most importantly, our most vulnerable who live in underserved areas are going to go without the attention they need. But you know what's more important? Those programs that are going to be cut because of these cuts that are coming down is the fact that access to medical care is going to be limited. Our health, mental health is we're in the middle of a mental health crisis. That's going to be cut. Our students who depend upon Medicare and Medicaid to be able to get that treatment they need, my seniors, my people with disabilities, my underserved communities. This is a catastrophic, in my eyes, issue that we have to continue dealing with. And I know, as a responsible legislator, it's my obligation not only to bring this to light by having this hearing to demonstrate the importance of what it is we need to get out and to listen. That's what today is about, listening to our advocates, our providers, our folks who are going to be impacted by this, and how they are going to ultimately impact the overall quality of life that we have here in New Jersey. And I'm not the only legislator in here that is concerned about this. I'm going to have a room full of legislators who are sitting up on the dais with me to listen to our folks. But more importantly, my leadership is extremely important and concerned about these issues, especially during the time that we are in the process of going forward with New Jersey. So with that, I'm going to turn this back over to the advocates, to those people who you're going to hear from today, to understand fully about what I'm saying. Because I can sit here and go on and on and on and on, but you have to hear it from the people who are going to be impacted. You have to hear it from those businesses. You have to hear it from my people who represent the seniors, who represent the underserved communities, who represent those middle-class workers who are working tirelessly to continue to provide for the family. And that's including health care. There's so much at stake, friends, family, neighbors, and I really want this to be a hearing that we fully understand, just the beginning. Many, many more conversations are going to continue, at least as long as I'm chair of the Health Committee. We're going to continue having these conversations. I'm going to have one-on-one conversations. I'm going to have roundtables. We're going to be doing what we have to do to talk to the various groups to continue understanding and getting a full story, getting the full impact of what this means for our families. So with that, I'm going to turn this back over to Laura. Thank you. Thanks, Laura.
Thank you so much, Chairwoman, for your continued leadership and commitment to hearing directly from all those who will be impacted. And next, I'd like to welcome James McCracken, President and CEO of Leading Age New Jersey and Delaware.
Thank you very much, Laura and Chairwoman, for your great advocacy and passion toward this topic. My name is Jim McCracken. I'm the President and CEO of Leading Age New Jersey and Delaware, which is a nonprofit trade association that represents mission-driven senior living and services providers across the spectrum. My association is extremely concerned regarding the impact of the proposed federal cuts to Medicaid on our members, from nursing homes to assisted living to home care. The cuts currently being deliberated in Washington, D.C. would have catastrophic effects on vulnerable adults in our state. Any Medicaid cuts would also further exacerbate existing workforce challenges in long-term care and have negative impacts on our local economy. It's important to understand that many of the elders my providers serve are not eligible for other types of insurance that would cover the gap for long-term care services and supports, like nursing homes and home and community-based services. Without Medicaid, it will either be private pay or no care. Many people with Medicaid, paid nursing home stays, or home and community-based services have already spent their life savings on care and are now reliant on this program to meet their basic needs. Medicaid programs have income and asset limits, meaning if an older adult is using Medicaid-funded services, they likely have no other means to pay for care and little left over to even cover basic needs like housing and food. New Jersey's current approach to delivering long-term services and supports cannot sustain cuts to the Medicaid program when Medicaid funding is already insufficient to cover the existing costs of care. Leading Age New Jersey and Delaware is actively opposing proposals to cut Medicaid in Congress through per capita caps, block grants, federal medical assistance, a percentage known as FMAP reductions, or a decrease in provider taxes. Budget reconciliation must ensure that the needs of older adults and providers who serve them are met. Thank you for asking me to come here and join you today.
And thank you, Jim, for explaining how nursing homes would be impacted. 4 in 7 seniors are in our nursing homes are enrolled in Medicaid. You know, I'd next like to welcome Teresa Luoni, a single mom of 2 sons with severe autism, both of whom are enrolled in New Jersey Family Care.
Good morning. My name is Teresa Luoni, and I'm the single mom of 2 beautiful 12-year-old boys who are profoundly autistic. Every day, I fight not just for their dignity, but for their basic right to exist safely and healthily in this world. Medicaid is not just a program to us, it's our lifeline. It provides the therapies that help my sons eventually speak a word, hold my hand, or look into my eyes. Without Medicaid, these services would be completely out of reach. And without these services, my boys cannot continue to grow into the independent, productive citizens they are capable of becoming. These supports aren't luxuries for us. They're investments in their future and in our society's future. But now, some of our leaders are proposing cuts to Medicaid, not to reduce waste, not to build a better system, but to funnel billions of dollars to the wealthiest people in this country. Let's be clear, slashing Medicaid is not fiscally responsible. It's a moral failure. It says billionaires deserve bigger yachts more than my sons deserve a future. When we strip health care from the most vulnerable, children with disabilities, the elderly, low-income families, we don't just hurt individuals, we harm our shared humanity. We turn our backs on the very idea that every life has value. I'm here to say my children matter. Millions like them matter. We cannot allow compassion to become a line item we cut. We cannot sacrifice our most fragile citizens on the altar of greed. America is better than that, and we must be better than that. Thank you.
Thank you, Teresa, for your courage and your relentless advocacy for your boys and for families like yours across our state. Next, we'll hear from Mary Coogan, President and CEO of Advocates for Children of New Jersey.
Thank you, Laura. So, as Laura said, I'm Mary Coogan. I'm with Advocates for Children of New Jersey, and I just want to talk a little bit about the 860,000 children who are enrolled in New Jersey Family Care. Who are these kids, right? We all know some of them are like Teresa's children, right, who have disabilities or some type of chronic health or intellectual disability or a health problem. Most of the children who are enrolled in New Jersey Family Care are from moderate income working families. Some of their parents, like a child care center provider who is getting just above minimum wage, may also be enrolled in New Jersey Family Care along with her 2 or 3 children. Infants and toddlers between the ages of 0 to 2 receive early intervention services through Medicaid. 90% or more of the children and youth living in foster care in New Jersey are on Medicaid. Children who cannot return home from foster care and are adopted by a relative or another family often receive a subsidy because they have special needs, and part of that subsidy is Medicaid. Children leaving foster care who might go to live with a relative through a kinship legal guardianship arrangement also may receive a subsidy, part of which is Medicaid. Students receive Medicaid school-based health services through their individual education plans or IEPs. Currently, we have a program, the Special Education Medicaid Initiative, which has existed since 1996. It is active in 408 school districts in New Jersey. Last numbers I saw, there's over 90,000 students receiving services in their schools funded by Medicaid. Medicaid also covers programs like Healthy Steps. It's a pediatric primary care model for children under the age of 4 and their caregivers. The model combines the expertise of a child development specialist, a behavioral health promotional specialist, and the pediatrician to focus on essential skills to foster healthy development. This is funded by Medicaid and was scheduled to expand in New Jersey starting in July. There are approximately 130 special education schools in New Jersey. They are for children who cannot be educated in their school district because of a health problem, an intellectual problem, or some type of other disability. They serve over 10,000 New Jersey students. A lot of the services provided in those schools are covered by Medicaid. New Jersey has a children's system of care. On any given month, it's through the Department of Children and Families. They provide services and treatment to children who have some type of emotional or behavioral problem. The Department of Children and Families estimates that they help 38,000 children every month. If parents have insurance, if my child needs some type of treatment through the children's system of care, they will use my health insurance. If I don't have health insurance, or if my child is enrolled in New Jersey Family Care, they will use New Jersey Family Care to pay for that service. And if I don't have insurance, the state will pick up the tab. If Medicaid is cut, that whole platform is going to be undermined because the state will have to come up with more state dollars to make up the difference. This is a system that's taken many years to get to a point where it is serving 38,000 children a month. And given the anxiety and depression of many of our students, I think it's critical. The department is estimating that if they cut the federal match from 50% to 38%, which is some of the conversation in Washington, there could be a gap of $38.9 million, and that would definitely jeopardize the children's system of care. One last group are approximately 80,000 young people between the ages of 19 and 21. And they might just be entering the job market, and they are enrolled in the Medicaid expansion. That's how they get their health insurance. But some of them are also young people that have aged out of foster care. And we have made a promise that we would cover their health insurance to age 26. And if Medicaid is cut, that program will also be in jeopardy. There's plenty of other kids I could talk about, but I'm going to turn the mic over to other people. I just want people to understand there's unintended consequences because of these Medicaid cuts. And New Jersey, to its credit, has used Medicaid dollars to supplement other programs like the Children's System of Care. And that is all in jeopardy. Thank you.
Thank you, Mary, for reminding us that the largest group enrolled in New Jersey Family Care Medicaid is our children, and that their health today shapes our state's future. Next, I'd like to introduce Gwen Orlowski, Executive Director of Disability Rights New Jersey.
Good morning, everyone. Thank you, Chairwoman Murphy, and to Citizen Action. Again, my name is Gwen Orlowski, and I'm the Executive Director of Disability Rights New Jersey. We're the designated protection and advocacy agency for the state of New Jersey, an independent nonprofit under a series of federal statutes on behalf of people with disabilities. Our mission is to advance the human, civil, and legal rights of people with disabilities and ensure they're free from abuse and neglect. Disability Rights New Jersey is at the forefront of Medicaid defense advocacy, urging Congress no cuts to Medicaid. We prioritize legal representation and advocacy around Medicaid eligibility and access to long-term services and supports because Medicaid is that important to people with disabilities and older adults. More than 300,000 New Jerseyans with disabilities and older adults branded New Jersey Family Care for more than 300,000. Medicaid is a lifeline, providing access to hospital services, doctors, specialists, prescription drugs, mental health services, dental care, vision, hearing aids, the list goes on. And more importantly, for many people with disabilities and older adults, Medicaid ensures their access to services they need to live their fullest lives, both in the community and in nursing homes. For people who choose to live in the community, whether in their own family homes, group homes, or assisted living, Medicaid provides critical day-to-day services like help getting dressed, preparing meals, doing laundry, taking a shower. with annual costs reaching $85,000 and frankly much more for individuals with intellectual and developmental disabilities in out-of-pocket expenses for home and community-based services. Long-term care in the community is unaffordable without Medicaid. For people who need the services and choose to live in nursing homes, Medicaid covers room and board, the cost of nursing services. And with annual costs exceeding $149,000 in nursing homes, long-term care in nursing homes is unaffordable without Medicaid. I think you heard the statistic, 4 out of 7 nursing home residents are on Medicaid. New Jersey Family Care Medicaid currently provides long-term care benefits not covered by Medicare to nearly 130,000 people with disabilities and older adults. And in 2024, 250,000 people with disabilities and older adults on Medicare received assistance from Medicaid for paying their premium and out-of-pocket costs. So be assured that a cut to Medicaid is a cut to Medicare. I also want to address the myth that people on Medicaid do not work. Statistics show that approximately 2/3 of working age adults are already working. And at Disability Rights New Jersey, we know that people with disabilities want to work and do work. We have one of the most work-forward Medicaid programs in the country, New Jersey Workability, and nearly 8,000 people with disabilities are on that program. Disability Rights New Jersey urges Congress to vote no in Medicaid cuts. The so-called reforms that are on the table, and Jim listed some, I won't list them again, all of these reforms, so-called reforms, take funding away from states or restrict eligibility will lead to the same result, cutting health and long-term care services for people with disabilities and older adults in New Jersey. We must tell Congress no cuts to Medicaid. Thank you very much.
Thank you so much, Gwen, for elevating the voices of the 1 in 3 New Jerseyans living with disabilities who depend on New Jersey Family Care Medicaid. And our last speaker this morning is Peter Chen, Senior Policy Analyst for New Jersey Policy Perspective.
Thanks, Laura, and thanks to Citizen Action. Thanks, Chairwoman Murphy, for calling this hearing today and having this press conference. As everyone has already stated, Medicaid is of critical importance to the state and to the health of its residents. And I'm here to talk about the impact on the state budget. Actually, Mary asked me when I came in, she was like, so what's the impact on the state budget? Answer, it's bad. It's really bad. The estimated cuts, right, if the federal proposal were to go through, would be about $2 billion at a minimum in lost annual funding for New Jersey. To put that in perspective, the entire state appropriation for Medicaid is less than $6 billion. So that would be a huge cost increase passed on to the state from the federal government that the state would have to make up somehow. And Medicaid is already an efficiently run program. Medicaid has very low overhead, 4% overhead compared to 16, 18% in the private market. Medicaid covers enrollees at a lower cost than private insurance, in part because of those low overheads. And New Jersey provider rates are already very low for reimbursement for doctors, nurses, and other medical services that are reimbursed through Medicaid. So any reductions in those costs are going to mean losses of specialists, loss of access to care, and worsening of an insurance program that needs more support, not less. And at the end result, a cut is a cut is a cut is a cut. There's no way to frame $2 billion in lost funding as anything other than a catastrophic cut, to use the Assemblywoman's term, a catastrophic cut to every kind of health insurance that's funded through Medicaid in the state. And to many other folks' points, Medicaid doesn't just fund the health insurance programs that are its core program. They also help to fund stuff like the children's system of care, behavioral health services, and help to subsidize some of the low reimbursement rates on the Medicare side. So what we're seeing, if this cut were to go through in its entirety, is a devastating loss to not just to the state budget, but in the end, to the human beings and the lives at the end that those state budget dollars help to support. The reason why tax and budget matter so much is because there are lives that are supported by these programs. That these are not abstract programs. These are human beings. And a $2 billion cut, that level of slashing is going to directly harm people's lives. We're going to see increased medical bankruptcies. We're going to see people, who have to lose their homes to afford medical care. And yes, the same way that Medicaid saves lives by keeping people on insurance and giving them essential medical care, if these cuts go through, people will die. And that is a direct result of the cuts that are being discussed in Washington right now. They cannot go through. And we urge the congressional representatives to reject even $1 of cuts to Medicaid, because those will affect the constituents and the Jerseyans living here today. Thank you.
Well, thanks, Peter, for highlighting the detriment of these proposed cuts to the state budget. And to Chairwoman Murphy, all of our speakers, and everyone standing with us today, and those who could not attend but send their support, like the American College of Physicians and the Healthcare Association of New Jersey, thank you. Thank you for raising your voices and coming together with urgency and unity. We urge all of New Jersey's federal delegation, including the members who sit on the U.S. House Energy and Commerce Committee, do not turn your backs on the families, the children, the seniors, the frontline workers, the institutions who rely on Medicaid. Vote no to any cuts. And please join us at 11 a.m. for the Assembly Health Committee hearing, where more voices will be heard. Thank you, and we'll now take questions from the media, if there are any, while being mindful of the DHS Senate budget hearing starting at 10. Thank you.